My name's Jonathan Webb. I'm a consultant orthopaedic surgeon. In my past, whilst being a medical student and doctor, I played for England. I've loved all sports, but rugby turned out to be something that took off. So in the middle of all that, I tore my cartilage in about 1988. I can remember the game, very innocuous injury, a tackle, twisted my knee, felt a pain, didn't think much of it, carried on playing, and then my knee started locking and jamming to the point that around about Christmas time, my knee locked completely. In other words, the cartilage flipped over, jammed in the joint, and I couldn't walk, let alone play. So having had that cartilage out, I've been fine for maybe 20 years, been very active, but in the last 5 to 7 years, it's begun to catch up. So I've had arthritis in that knee. Arthritis can affect you in lots of different ways. Obviously, pain is usually the most obvious thing, but for me it's the lack of movement in the knee. It won't bend properly and it won't straighten properly, and that actually gives me difficulty. I mean, stupid things like sitting in a narrow seat, in a sports stadium or a cinema or even a car. There's a limit to how long I can sit with the knee bent. The operation I'm going to have is quite a big one, so you don't want to go into it lightly, but I know it's the right time to have it done.
The great thing is that Jonathan's very active and he's very keen to get back out and be sporting and doing his activities, but also actually just get him out of pain so he can be comfortable in day-to-day things and get on with his life.
I think it's always difficult to operate on a colleague. There's an extra level of pressure involved, and I think the two of us are very experienced now in using the Mako together. Jonathan does have a difficult knee, so we're going to use our combined expertise to give him the most optimal outcome.
A little bit apprehensive, but I think that's normal. And when my patients say that to me, I say, look, that's really okay to be like that. It's a big thing, but at the same time, quite excited because it is the right time to have the surgery done now. I want to have a knee that I can use better, and hopefully that'll be the outcome we get. I'm very confident that's how we're going to end up. So the reason I chose Mr. Lavelle and Mr. Hulan-Byrne is that I've known them for a long time. Their quality is unquestionable. They're both really great surgeons, but they're also very good communicators. I couldn't be in better hands, and I feel very confident and reassured that the outcome will be the best it possibly can be. And that's really all you want from your surgeons, plus a great manner and knowledge about looking after people.
One of the great things about using the Mako and the robot assistants is actually trying to get the best possible balance of the soft tissues around the knee so that the prosthesis may not change a lot, but if we can actually get the precision in terms of the way we put it in, we hope that we'll get better outcomes and better longevity.
My experience with Lavelle and Hulan-Byrne was absolutely what I hoped and expected. The way they conveyed how the surgery had gone, how they felt things had been, was just perfect for what I needed. Since surgery, I'm feeling better and better. It's now just over 6 weeks from the day of surgery. It's pretty much a constant thought in your mind affecting what you do, but there are now gaps where I'm just not thinking about it, when I'm just walking around day to day. In a sense, I've just reached neutral. So now to get any sort of capacity back or function back, I've got to work really hard to get the strength, and that'll be some bullying or coaxing from the physios, whichever way you look at it, and really commitment from me. There are some things I won't be able to do, like five-a-side football, which I managed up until about 6 months before the replacement. But things like skiing, cycling, walking, hiking in hills, in other words, being very active and adventurous, but not doing things that will jeopardize the longevity of the knee replacement. That's the way I look at it. It has got a long way to go to be the ultimate success, but I've already got more movement in my knee than I had before. That was one of the critical problems that I was suffering with. The fact that I was driving at 2 weeks, the fact that I managed 2 holes of golf with my son at 4 weeks, and the fact that my movements come back. I think that all speaks volumes about the functionality of the knee. There's still work to be done, but I think the progress to date has been really good.